are really excited to present and share our manuscript on physical activity in patients who have a cardiac implantable electronic device and really compare the physical activity patterns during the COVID-19 pandemic. Hi, my name is Abhishek Deshmukh. I'm one of the cardiac electrophysiologists here in Rochester, Minnesota. I'm an associate professor of medicine. And today I wanted to share with you our fascinating study on physical activity in cardiac implantable electronic device recipients during the COVID-19 pandemic. And I'm sharing this data on behalf of my colleagues and Dr. Malini Madhavan, my senior author on this manuscript. So we know that COVID pandemic has really raised hell and more in the last few years. And WHO declared the COVID-19 pandemic in March 2020. And all the newer words which we had not thought about, such as social distancing, activity limitations, have come about in the last few years. What we know that patients with chronic heart conditions and comorbidities are vulnerable to severe COVID-19 infections and hence are strongly recommended to adhere to public health guidelines to avoid contracting the disease, hence social distancing. So in this paper, we sought to characterize the physical activity level and differences in activity level during the COVID-19 pandemic and compared to the year 2019 when there was no COVID-19 pandemic in the recipients of any cardiac implantable device such as a pacemaker, defibrillator, or a CRT device enrolled in through the Biotronic remote monitoring registry called as Certitude. So physical activity can be sensed by any of the cardiac devices by comparing the acceleration measured on a particular axis. And this accelerometer collects physical data independent of the programming of any rate responsive mode. So through this, we were able to analyze data from about 21,660 patients who were implanted with a Biotronic device, such as a pacemaker, ICD, or a CRT device. About 57% of the patients were men. Majority of the patients had a pacemaker, but about 30% of patients were sicker and had an ICD and a CRTD in place. Now, this is the most fascinating part of our results. We noted that there was a significant decline in time spent being physically active noted in 2020, especially March, April, and May compared to the 2019 time period. Now, this difference was also noted across gender. So as you can see, again, compared to men and women, there was a significant decline in activity level as soon as the restrictions were made during the pandemic. And gradually, the activity level increased again, towards the summer months. There was really no difference in the physical activity for subjects, again, by age, because all of them had a steady decline in activity level, irrespective of how old the patients were. But it's interesting to know that patients above the age of 80 had significantly less rebound in subsequent months during the pandemic. Again, when we looked at different physical activity for subjects by devices, patients who were more sicker, for example, patients with a CRTD in place had the most decline in activity level compared to patients who are not so sick, such as somebody with a pacemaker. And finally, the activity level was noted to be less, irrespective of which region of the country the patients were from. And there was a significant decline in activity level across the board. We also noted that the atrial arrhythmia burden increased during the pandemic, but this may or may not be related to the activity alone, and it could just be due to aging population. So we conclude that there was a significant decline in physical activity observed in individuals with a cardiac device. And further investigation is important to really establish the impact of this reduction of physical activity on short and long-term cardiovascular outcomes. The reason why this is important that the potential effects of restricted physical activity during quarantine periods on our cardiac outcomes have not been very widely reported. But again, the lack of physical activity cannot be ignored. We all know that even some decline in physical activity, even 10 minutes or more per day, have resulted in increased risk of heart failure and more mortality in patients who have a cardiac device. So we believe that our results can shed some light into the impact of decline in physical activity and see how we can potentially avoid this happening again, God forbid, if we have another situation of social distancing, where maybe home exercise, some sort of activity at home may help to reduce the impact of decline in physical activity and reduce overall mortality and morbidity. So many thanks, and I hope you find our manuscript interesting. Thanks a lot.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.